My name is Julie Clements. I am the Chief Solutions Manager here at MOS. Today I wanted to talk about CMS and how they've announced the Section 1135 waivers to help in battling COVID-19. So as we all know, the entire global population is going through extremely trying times, and with total and partial lockdowns and numerous other restrictions put in place to control this COVID-19 epidemic. Recognizing the need of the hour to ensure patients easy access to medical treatments, the CMS, so Centers for Medicare and Medicaid Services, they've announced the Section 1135 waivers to support the government's efforts to battle COVID-19. Indeed, in situations such as the present one, making emergency medical treatment available to those affected is most important. And in normal circumstances, health insurers may utilize processes such as medical peer review to determine coverage eligibility for their plan members. However, in extremely hazardous and emergency situations such as we find ourselves in now, all are focused on providing the required facilities and care to patients. So what is this waiver? Under Section 1135 of the Social Security Act, the HHS Secretary may temporarily waive or modify certain Medicare, Medicaid, and Children's Health Insurance Program requirements. This is to help make sure that adequate healthcare items and services are available to meet the requirements of individuals who are enrolled in Social Security programs in the emergency area and time periods, and also that providers who provide services in good faith are reimbursed and exempt from sanctions. If there's no fraud or abuse involved, some examples of 1135 waivers are for the following: program participation and similar requirements, pre-approval requirements, conditions of participation and other certification requirements, performance deadlines and timetables may be adjusted but not waived, stark self-referral sanctions, limitations regarding payment to permit Medicare enrollees to use out-of-pocket network providers in an emergency situation. Waivers under Section 1135 end no later than the termination of the emergency period or 60 days from the date the waiver or modification is first published, provided the Secretary of HHS doesn't extend the waiver by notice for additional time up to 60 days, up to the end of the emergency period. The EMTALA waivers for public health emergencies that do not involve a pandemic disease and waivers for HIPAA requirements are limited to a 72-hour period starting from the implementation of a hospital disaster protocol. CMS waivers associated with COVID-19 pandemic. The following are critical access hospitals. So CMS is waiving the requirements that these hospitals limit the number of beds to 25 and that the length of stay be limited to 96 hours. Another is housing acute care patients in excluded distinct parts units. So CMS is waiving requirements to enable acute care hospitals to accommodate acute care inpatients in excluded distinct part units where the distinct part units bed are suitable for acute care inpatient. Another is DME, so durable medical equipment. If DME, prosthetics, orthotics, and supplies is lost, destroyed, irreparably damaged, or otherwise becomes unusable, contractors are allowed the flexibility to waive replacement requirements with a face-to-face requirement, a new physician's order, and new medical necessary documentation is not required. Skilled nursing facilities. So CMS is also waiving Social Security Act Section 1812F, requirement for a 3-day prior hospitalization for coverage of an SNF stay to provide temporary emergency coverage of SNF services without a qualifying hospital stay for people who may have to be transferred as a result of the effect of an emergency or disaster. And the list goes on. I would highly recommend going to our site so you can read more about this information. Our site is mosmedicalrecordreview.com, and you'll find everything bullet pointed listed out here. Medicare appeals and fee for services and MP and Part D. So this also talks about the extension of file an appeal, waive timeliness for requests for additional information to adjudicate the appeal, utilize all flexibilities allowed in the appeal process. There's so much good information, and they've really made some changes for people to help make it work. So CMS doesn't require states to use any specific form or format to submit a request for the Section 1135 waiver. States must clearly state the scope of the issue and the impact it has made. The request can be made directly to Jackie Glaze, who is the CMS Acting Director, Medicaid and CHIP Operations Group Center for Medicaid and CHIP Services. Requests can be sent to her email at jackie.glaze@cms.hhs.gov, or you can send a letter. As a chart review company serving Social Security and insurance lawyers, we know how crucial it is for private as well as government payers to rise to the occasion and lighten the financial burden on patients who have fallen victim to COVID-19. Again, please go to our website at mosmedicalrecordreview.com for more information. Thank you.